The streets of downtown Lexington, Kentucky are oddly quiet for this time of year. Due to the COVID-19 pandemic, establishments have closed and many Kentuckians now work from home. Playgrounds have been closed by Lexington Mayor Linda Gordon, and schools and universities are shuttered, giving students more time to spend in nature with their families and their pets. But for the next generation of healthcare workers, Kentucky's medical and nursing students, the COVID-19 pandemic presents some problems.
We are supposed to get in what's called a preceptorship, where we do 8 hours in the ER and 16 hours of either specialty or primary care. The students who didn't complete those hours before these restrictions went into effect are getting an incomplete for that grade until this is lifted, and then they can finish out their hours, hopefully in the summer, if that's when this all kind of goes back to normal.
Nursing is very hands-on, and you can't really learn it through textbooks. You have to experience it for yourself. There's a lot of skills involved, and throughout this semester, once the coronavirus kind of hit everybody, our professors were really unsure of what to do, so we had a 2-week delay with spring break and everything.
All of those important summer experiences that we're supposed to have to be able to match into residency have been canceled. So that's going to be a challenge for a lot of people. There's really nothing that we're allowed to do medically related this summer, so we're told that we can babysit and we can do community volunteer work that doesn't have anything to do with medical.
So they started making us have these online clinical experience simulations that were honestly terrible. They don't help you learn. They're just a lot of hours of busy work, and it's very frustrating when the program doesn't work correctly or you don't have the right access to good Wi-Fi or anything. So it was very hard for a lot of people to adjust to this. I also work at the hospital right now. Recently I haven't been able to work that much because I'm PRN, but I worked back in March, right when everything started, and I know there was already a shortage of personal protective equipment, and that's very hard when you have a lot of rooms that are in isolation. So to keep you safe and other patients safe, you have to wear masks and gowns, gloves, but they're you can only have so many masks per day and everything. So it's very scary to be going into rooms that you need protection from and maybe not having that protection, and then being around friends and family and worrying about exposing them. So I would say the coronavirus has definitely negatively impacted my education and my work experience.